When we see infected animals, we try to determine the specific fungus that is causing the infection. We know all young animals are susceptible to dermatophytes, regardless of whether it's M. canis or M. gypsum or trichophyton. The young mammal is just immunologically not mature yet, so they are more susceptible. But if we have a kitten in a home with M. canis, that kitten is more at risk toward transmitting infection to other animals and children than a kitten with M. gypsum, or even perhaps a kitten with trichophyton. So in the old days, we used to advocate for taking these kittens and isolating them. And we think now that's excessive. These are young animals that have to be socialized. And to take a young kitten who's just learning to explore the world and shut them up in a room, I think is harsh. And so we're stepping back from that. We're trying to take a more holistic approach, looking at the risk. So it may be that it makes more sense to keep the kitten confined maybe to a room where at least the kitten's going to see people, and that an adult would take responsibility for treating the kitten so that small children would not be infected. Dermatophytes in most people are not serious infections. Most veterinarians and their technicians have had a dermatophyte infection. Where it becomes a problem is if a person is immunosuppressed. So all of these sort of historical factors go into how we would design a treatment program. It's not one standard procedure. We look at the family, the kids, without trying to pry into private medical business, what medical problems we may be dealing with in the family, so that we can make good advice.